today. Drive home a popular new 2021 Kia Soul for only $159 per month. And if you have a job bringing home $350 per week, we want to approve your credit. Only at the Kia stores. Visit kiastore.com.
Welcome back to WAVE3 Listens Live. If you live here, and you probably do if you're watching this show in the Ohio River Valley, then you may have some problems with your ears, your nose, your throat, allergies. We can help you right now. With me now is Advanced ENT and Allergy. These two doctors here are going to talk about some procedures that are less invasive and give fantastic results. Dr. Vasu Kakarlapudi. Dr. Kakarlapudi, welcome to the show.
Thank you.
And Dr. Colin Neumann, welcome to both of you.
Thanks for having us.
Okay, first of all, Dr. Kakarlapudi, I want to go to you first. Talk a little bit about the procedures that I just referred to there. What procedures do you perform?
Yeah, so we've got various procedures to help people with the front of their nose who have problems with their breathing, their middle of their nose where a lot of the sinuses drain into the nasal cavity, and the back of the nose that causes a lot of drainage that people feel in the back of their throat. So a wide variety of different things to help with your individual problem. So with an analysis of kind of where the problem is, we can target our treatments to those specific areas.
And from what I understand, Dr. Neumann, these procedures, it's like, I love the way your field, medical field, evolves. They're not as invasive. You don't have to go through all this expensive surgery and recovery. Talk about these procedures and why the two of you decided, hey, let's start a practice and perform some of these procedures here.
Sure. And so historically, there was either medications or surgery. And we wanted to find, is there a medium ground between medication and full-on surgery where people can get similar results, go through less of the morbidity that is usually associated with surgery, while also saving cost. And I think that's where these in-office minimally invasive procedures come from, and where our passion comes from is treating people, getting good outcomes, causing less morbidity while hopefully also saving that patient money.
See, I like the sound of that. I think it's interesting because not only is it medically advanced, but you know what? Everyone's on a budget. That doesn't hurt. If it's going to cost me less and I have to go through less pain, less recovery time, perfect. That works for me. So talk to me a little bit. Can you get specific to Dr. Kakarlapudi about a specific procedure and how it is different and how it does make things happen quicker and less invasive?
Yeah, so a lot of people have a lot of problems getting airflow through the very tip of their nose. And so a lot of your audience has used breathe right strips before. Mm-hmm. And if they get benefit from breathe right strips, there are a couple of procedures in the office that we can do to help support that very front part of the nose. So I always like to describe the nose as a house. And if you're trying to get air from the front to the back of the house, your front door has to open. And if your front door doesn't open real well because it's a flimsy drawer or the opening is very narrow, we can essentially put a door stop in there or strengthen the door to keep it from closing inward when we take a deep breath.
So this procedure, Dr. Neumann, I'll ask you, how is it advantageous? What are the advantages for the patient as opposed to maybe an older method?
Sure, and so to use myself as an example, I actually had one of these procedures done on me probably about 2.5 years ago. And so day to day, I was breathing fine through my nose. But whenever I wanted to exercise vigorously, I wasn't breathing how I wanted to through my nose. And I had him take a look, and old school ways of improving my nasal breathing would have been taking me to the operating room and probably, removing some cartilage from one part of the nose and rebuilding and supporting with that cartilage in another part of the nose. And we kind of talked about it like, well, there's this new technology, let's try it. And so I was patient 0 in Indiana, the first person to have this kind of procedure done. And since then, I've had no nasal breathing issues whatsoever. It took about 5 minutes to do. I was awake the whole time and back in the office the next day seeing patients, and nobody had any idea I had anything done.
I love that story because you believe in the procedure. You did it to yourself and it worked. Mm-hmm. And you've had a family member, correct, Dr.
Yeah, I've done some of these minimally invasive procedures on my godson. So people that I love dearly, and that's part of the reason why we got involved in this, is because we wanted to treat our patients like we'd want our own family treated. And for my own family and for all of our patients, we'd like to offer them the least invasive option first and then reserve surgery that takes a lot more time and effort and recovery for as a last resort, unless it's a life-threatening issue, obviously.
I love hearing this. Okay, we're going to take a look at some before and after pictures. And I've been talking about sports. We had Robbie Valentine on talking about his basketball camp. So you guys, sports analogy. Okay, do the play-by-play here. Give me the color analysis. So if you would, Dr. Kakarlapudi, what are we looking at here?
So this was a patient that I had worked on Friday. So what we're looking at is we're looking at with a little telescope inside of the nose at the sinus. Like if you draw a line from the top of your head to your ears and where that would meet in the center of your head, there's a sinus called the sphenoid sinus. And so what we're looking at is this sinus is plugged. And so what you're looking at is a small little metal probe that we're using to find the natural opening of that sinus. And we're probing to see where it is because we don't want to stretch another area. Again, this is minimally invasive, so we're trying to stretch that particular area. And so this is us with the little camera about almost 3 inches from the tip of the nose back, finding that natural opening.
All right, and then we move on here to the next picture. What are we looking at
So
here?
once we found that opening, we used a balloon catheter to basically thread through that opening and stretch it out, microfracturing some of the soft bone and cartilage that blocks off that sinus.
Let's talk a little bit about recovery here. So Dr. Neumann, if you go through this procedure, there's the after picture. Wow, that's a lot better, a lot larger, and that's what you want, more oxygen, correct? Okay, so let's talk a little bit about recovery. What will a patient endure, or what will they not endure?
Sure, and part of this depends on the person. Everyone recovers differently. Everyone has different thresholds of pain. It also depends on what procedure they're getting done. I kind of talk to each patient differently about what they're having done. I will say that compared to surgery, you're looking at a fraction of the pain, the need for narcotics, and much quicker return to normal life and work. That's kind of what I would say. It's hard to say like exactly everyone's the exact same.
So far, you're hitting the checklist. Everything sounds like it's an advancement. Now let's talk about cost effectiveness. Dr. Kakarlapudi, is this cost effective?
Yeah, I mean, one of the largest pieces of surgery cost is all the other stuff that comes along with the surgery, not just the surgeon's fee, but the anesthesia, the facility, the pathology, all the studies that have to be done before you go into surgery. And so in our office, we try to be cost effective because, you know, it's tough times for a lot of folks, and healthcare continues to become more and more expensive, and we feel the pain ourselves with our own insurance policies, and we wanted to certainly do our part to provide options that are transparent, so we disclose the cost, the total cost on the front end before you commit to anything, but also I think most of our patients have commented that, wow, we like having one bill that's a lot less than the surgical options.
This sounds fantastic. Okay, Advanced ENT and Allergy. Before we go, Dr. Neumann, where can people go for more information? Obviously, if you have an immediate need, call the office, but if they'd like to get more information and read up a little bit, where can they go?
So everything's on our website at advancedentandallergy.com, and now you can actually make appointments right on the website at this point.
All right, gentlemen, I thank goodness, and I'm sure there are a lot of viewers who are watching saying, I'm glad that you set up shop here, because am I wrong? We have some issues here, don't we? We can laugh about it now, but you know, it's true. This is like a hotbed for problems at the ear, nose, and throat, right?
Absolutely.
And allergies especially.
Absolutely.
Thank you very much, gentlemen. Appreciate that. Dr. Neumann, Dr. Kakarlapudi, again, Advanced ENT. Go see Advanced ENT and Allergy. Make sure I get that clear. All right, coming up here, would you like to lose a little weight before you head to the pool? Guess what? Amy Stone is here, and she's going to tell you about Rev Body Sculpting. She can do it, and she can do it quickly. We'll be right back.